Welcome to Reswell Radio. I'll be your host for this evening. So, I have some fun questions for you. For you as a provider, when you're working with parents who are new to the mental health journey, maybe exploring working with a psychiatrist or medication management or therapy, what would you say to a parent who really is just getting started, doesn't know what all of this means, and maybe there's some guilt, shame, or like fear for their kid? What are some of the things that you do to help guide them and navigate them towards making the best decision for their family?
I love that question because it's kind of like really bringing in uh, like a lot of intentionality into the person as being part of a system, right? And
Hmm.
part of a network and a community even.
Yeah.
Um, a lot of the conversations that I end up having with families when their child is diagnosed or when adults when they are diagnosed late is a diagnosis um, is something that is clinically determined, right? So, meaning diagnoses are just kind of like a collection of a set of symptoms that doctors kind of use to help guide their treatment. It doesn't really talk about the context in which these diagnoses were like described, like who first described them or how they came to be. So a
Hmm.
lot of people sometimes, because there's a stigma associated with having any kind of condition, be it medical, mental, physical, whatever, in our society, I think it's okay to like question what is ADHD? Is it something negative or is it something positive? Are there like a lot of benefits as well possibly to this? And I tend to encourage people to kind of see that our society tends to be quite harsh
Hmm.
in that it has this idealization of people that are able-bodied, higher socioeconomic status, and able to perform in a very singular kind of capacity in terms of like performance and achievements and accolades. And those are the people that are kind of like applauded. Whereas anyone that has any kind of difference in how they interact with their environment or how they take in information or how they process information or how they move through the world is not necessarily like supported. And I
Hmm.
think that that is not to say that those values are right. I think we should just look at them kind of critically and be like, do we agree with that? Right?
Hmm.
Before kind of move forward and say like, yes, this is something that needs to be corrected or fixed. And I don't necessarily think that ADHD is something that needs to be corrected or fixed. I think it's something that's like a unique quality and type of like, it's just a different flavor of like hardware, have that a lot of people have, a lot of people have. And and so it's okay to like pause and celebrate like the creativity, like the capacity to be in the moment, like how important they are when there's an emergency or when there's a crisis. Like absolutely, like every emergency medicine doctor probably has some like flavor of like ADHD, I would say. And so
Yes.
I think it's when I offer the tools that I have, which are medication, a lot of times I'm saying this is not necessarily something I'm offering you because I think that there's something broken or there's something wrong. This is
Hmm.
simply like a tool that I'm offering to navigate a world that is not kind to people who don't necessarily fit into that idealized box or category, right? And so I want you to have tools, I want you to have mobility to do what makes you happy, but listen to yourself, listen to what makes you happy. And if you're so like privileged to be able to have access to create like a world around you that is supportive of you, like totally lean into that and that's okay, Maybe you're going to be an outside the box kind of like thinker, maybe you're going to be an outside the box kind of you're going to march to your own drum. Like that's just the way it's going to be, and that if you can do that, make that happen. You don't have to fall in line with what everyone else is doing because maybe you're just not built that way, and that's okay too.
It's such a beautiful but real, honest perspective on like what this journey is. When it comes to you, your practice and your approach, how do you recommend parents have these conversations with kiddos about sharing the news of the diagnosis, what it means, and how to really honor this as like something to even be excited about, or like, hey, this is how your brain works. This is stuff we want to know. What does that journey look like with you?
I like to, and anytime anyone asks like a question, kind of seeking some kind of confirmation, I want to be clear that we're on the same page. So I usually start with like, what do you mean by ADHD? What does that mean to you? Like, what's their concept? Because they're coming into it with some concept of what that means already. And I think that's
Hmm.
very helpful to know before you kind of like have that conversation as to like what bias they may be already kind of carrying in their little heart, you know?
Yep.
So I usually start with that to kind of see like, oh, it's like, when you can't focus and you can't get anything right. Like, whoa, like let's address that.
Let's talk about that. Yep.
Yeah, yeah. Yeah, but I think talking about it and normalizing it is great. And saying like, yeah, this is how your brain works. There's lots and lots of people who are just like you. A lot of people who don't even know that they're just like you and they're still learning about it.
Mm.
And there's nothing wrong with it. Um, and I think the more you learn about yourself, like the better off you'll be, like because you have to kind of play to the strengths. There's lots of really beautiful, wonderful things about having an ADHD brain. And I think sometimes parents or people don't want to acknowledge the diagnosis because that's their own bias that they're bringing into it. It's like, I don't want my kid to be labeled differently. I don't want them to have to suffer that. But I think a
Mm.
lot of times people feel like empowered by it, and I think that's okay, especially if you are normalizing it all rather than if you're bringing in your own insecurity. They're going to pick up on that, like that's what they're looking at us for reassurance. We're like their number one teachers as parents. Like they're always looking to us. They sense things, they sense how we feel about things, they pick it up before we even do. And so like if you haven't examined your own bias the about these, any kind of like condition that you may be discussing or considering, then like that's going to be kind of potentially
Mm.
communicated in those conversations too.
This is so great. I have one question for you. I'll let you get one more. Let you get on with your day. Um, for you within your practice, are there certain folks, kids, adults, types, like sort of your speciality? How would you define your core group that when you start working with them, you're sort of in your happy space? Like, what is that demographic for you? What does
Yeah,
that look
for
like?
sure. I mean, I think it's anyone who's open to kind of who's curious about their inner world and also like potentially open to being critical about the context in which everything is happening. I think I bring in a lot of conversations about the societal values and how that impacts our sense of selves and what we internalize along the way. Like, were we born believing these values? Like, likely not, right? Like, we
Mm-hmm.
pick them up along the way. But, like, let's pause and examine them and see if we're applying them to ourselves unjustly, or do we actually believe in these
Mm.
values? And so I think bringing people that are open to bringing in having those conversations, I think will do well with me.
Mm-hmm.
Generally, I work with like kiddos, probably like second grade and up. Like I see all ages. I love working with like queer and trans kids, like people of color from the global South majority. I understand like minority mental health and stress. I work with like refugees, asylum seekers. I'm Spanish speaking. It's my first language. I work a lot with like chronic pain. I've like have some background in chronic pain and that overlaps
Mm.
a lot with trauma. So I'm pretty like well versed in dealing with trauma. But really anyone, yeah, who's open to kind of having those conversations. So like I try to work from like an anti-oppressive lens, meaning, and that's where that kind of critical eye about the
Mm.
context in which these problems are arising really is coming in handy, because I really want to make sure that people know what's within their realm of like control and what's not, and not to like internalize like the world view, how the world may view us, and starting to like unpack some of that as we're talking. Because the medications, from what I've learned, they only do so much. They're like a tool. There's so much more else that we need to kind of work on, like collectively as a community. And that
Mm.
starts with a cultural shift and having these conversations. So sometimes can be uncomfortable, but a lot of times really can reveal a lot about yourself and about how we were raised and how we want our future to look like and what kind of
Hmm.
ancestor we want to be to like, the people that come after us. So